Life Simple 7 is the American Heart Association's 7-point recipe for good heart and brain health. The 7 parts of Life Simple 7 are not smoking, healthy eating, physical activity, maintaining a healthy weight, having a healthy blood pressure, having a healthy blood cholesterol, and having a healthy blood glucose. If one is in optimal state in each of those 7, the likelihood of a long, healthy life, the likelihood of not suffering from heart attacks, strokes, heart failure, and a long list of things we want to avoid is very, very high. And so we at the American Heart Association are big on Life Simple 7.
The care plan is based on Life Simple 7. Life Simple 7 are easy to understand and easy to embrace ways to promote the health of your heart or manage your heart disease. These 7 areas, physical activity, nutrition, weight, smoking, cholesterol, blood pressure, and glucose, plus medication management and stress, will be the basis for the development of your personalized care plan. You will learn which areas you are doing well with and areas that need more attention. Living an active life is one of the most rewarding gifts you can give yourself and those you love. Simply put, daily physical activity increases the length and quality of your life. To improve overall cardiovascular health, we suggest at least 150 minutes per week of moderate exercise or 75 minutes per week of vigorous exercise, or a combination of moderate plus vigorous activity. 30 minutes a day, 5 days a week is an easy goal to remember. You will also experience benefits even if you divide your time into 2 or 3 segments of 10 to 15 minutes per day. A healthy diet is one of the best weapons for fighting heart disease. When you eat a healthy diet, you improve your chances for feeling good and staying healthy for life. You may be eating plenty of food, but your body may not be getting the nutrients it needs to be healthy. Nutrient-rich foods have minerals, protein, whole grains, but are lower in calories. They can help you control your weight, cholesterol, and blood pressure. Eat an overall healthy dietary pattern that emphasizes a variety of fruits and vegetables, whole grains, low-fat dairy products, skinless poultry, fish, nuts, and legumes, and non-tropical vegetable oils. Limit saturated fat, trans fat, sodium, red meat, and sugar-sweetened beverages. When you shed extra fat and unnecessary pounds, you reduce the burden on your heart, lungs, blood vessels, and skeleton. You give yourself the gift of active living, you lower your blood pressure, and you help yourself feel better too. Ideal weight is based on the body mass index, which is a ratio of weight to height. A BMI of greater than 25 is considered overweight. Losing weight means changing the balance of calories in to calories out. If you eat more calories than you need, you can gain weight. If you eat fewer calories than you need, you'll lose weight. Cigarette smokers have a higher risk for developing heart disease. If you smoke, quitting is the best thing you can do for your health. While smoking and smokeless tobacco increase the risk of heart disease, cessation from tobacco will reduce your risk. Tobacco is very addictive, so quitting might not be easy, but the American Heart Association has resources that can help you make quitting easier and more sustainable. High blood pressure is a major risk factor for heart disease and stroke. When your blood pressure stays within healthy ranges, you reduce the strain on your heart, arteries, and kidneys. This keeps you healthier longer. An ideal blood pressure is 120/80 or lower. Between 120 and 130 is considered pre-hypertension. Greater than 130/80 is now considered high blood pressure or hypertension. Blood pressure can be managed through a combination of lifestyle change, including physical activity, reducing sodium intake, and stress management, and medications prescribed by your doctor. High cholesterol contributes to plaque, which can clog arteries and lead to heart disease and stroke. When you control your cholesterol, you are giving your arteries the best chance for remaining clear of blockages. High cholesterol can be caused by an unhealthy lifestyle and a family history of high cholesterol. The decision to treat cholesterol with medications is one that you will make with your doctor, based on your overall risk for heart disease and stroke. High cholesterol can be controlled with medications, including statins, and by reducing fat intake, weight loss, and exercise. Most of the food we eat is turned into glucose, or blood sugar, that our bodies use for energy. Over time, high levels of blood sugar can damage your heart, kidneys, eyes, and nerves. A normal fasting blood sugar is between 70 and 100. A fasting blood sugar between 100 and 25 is considered pre-diabetes. A blood sugar of greater than 125 may be an indication of diabetes. Reducing blood sugar can be achieved by avoiding foods and beverages with added sugars, increasing physical activity, and maintaining an ideal weight. In addition to Life Simple 7, stress management and medication adherence, for those taking medications for blood pressure, cholesterol, and glucose, are keys to promoting heart health. In both cases, behavior modification is a key element of complying with positive behaviors, such as increasing physical activity, eating better, taking medications, and avoiding negative behaviors. This information will form the basis for your personalized care plan.